Hi everyone, Dr. Nemechek here, and I want to talk some more about POTS, or postural orthostatic tachycardia syndrome. Basically means when you're upright, your heart races. I've talked about this in a couple cases before, and I've got two cases here I want to talk about that were complicated by COVID, and how you have to manage that. So first. So POTS, postural orthostatic tachycardia syndrome. All right. This graphic here, the autonomic nervous system. POTS is problems with the autonomic nervous system. Okay. Think of it as an injury. Now, most injuries to the autonomic nervous system make it difficult for people to regulate blood pressure properly in their head. It doesn't feel good. When you have low blood pressure in the brain, you get low oxygen delivery to the brain, and the brain doesn't work right, and you get a whole bunch of symptoms from it. Okay? Now, most people will have what we call neurogenic orthostatic hypotension. That is autonomic damage with kind of low blood pressure mainly. The main symptoms are a lot of lightheadedness. I might pass out, or they are passing out. They can't focus. They get a lot of fatigue. POTS is injury here, but a predominant thing is the heart isn't responding correctly. So your heart rate is a pump to give blood pressure to your head. Okay, if you got low blood pressure there, it's going to want to increase. A lot of people with low blood pressure, their heart rate may go to 100, 110. What the issue with POTS is, people stand up, and now you got this gravity working on you, and their heart just takes off. They'll go up 30, 40, 50 beats, and they feel like their heart's going to explode, and it's often associated with a bunch of anxiety. And so that's kind of what POTS is. It's just a different way that you have this blood pressure to the brain regulation problem. Okay? Now, I and other researchers were discovering about 20 years ago that when people get a concussion, they often have damage to the autonomic nervous system. And what we were discovering is that people were not able to recover as well to injuries. And typically, if you had a bad concussion, so a concussion is you damage some neurons, there's no bleeding in the brain, and you have symptoms more in a day, basically. If we knew back in the 70s and 80s, if you were, say, knocked unconscious for 5 minutes, you'd be normal. A couple weeks, couple months. Everybody, okay? Then within the last 20 years, we started noticing, hey, people are not fully recovering like they used to, and it's because of chronic inflammation is what's happening. And we're going to talk about that, and that's the basis of the Nemechek protocol to help not only POTS, but a wide variety of nervous system issues to recover. So, POTS, how do they make this diagnosis? Now, I borrowed this from a website, and I'm going to put they've got a very nice little brochure. I'll put a link to them in the description of the video. If you have POTS or wondering about it, it's a very nice, well done site. So here you can do a simple tilt test. Now there's these fancy ones. They strap you to it in the cardiologist's office, and they do all this kind of stuff. But you can do this at home. Okay, you got to lay down for about 10 minutes. You got to get your body to rest, and then you stand up for 10 minutes. So when you're laying down, you check your blood pressure and your heart rate. And then you stand up here, and then after 10 minutes, you check your blood pressure and your heart rate. Don't do this alone, because sometimes you might pass out. Okay, even if you're like, I won't pass out. Trust me, sometimes you'll pass out. Don't do this alone. You got to have somebody there with you, just in case. Okay. And if your heart rate goes up by 30 beats or it's over 120, you got POTS. And especially with this, people are tired, headaches, they might get kind of anxious, they can't focus, they're dizzy or lightheaded, so you get these low blood pressure symptoms. And then plus this, you've got POTS. I should also add, I'm saying all that, That is, you've seen your doctor, they ran some blood tests, everything looks normal. They can't figure it out. Then you do this, and then you got POTS. So our protocol was really designed. We started working on this about 25 years ago in an effort to reduce autonomic dysfunction, and our work advanced to a point where I'm proud to say we were actually here in 2019 issued a patent for methods of reversing autonomic nervous system damage. Patrick M. Nemechek, that's me. And the basis of this is to reduce inflammation, because we now know the brain is fully capable of recovering if you don't have excess inflammation, okay? And the protocol consists of balancing the intestinal tract, the bacteria, supplementing with fish oil, with olive oil, and using a vagus nerve stimulator. All right, so here's the first case. A young woman, Marta. So pretty healthy, pretty normal, gets COVID here, a year and a half ago. And COVID will give you a brain injury, all right, just from the inflammation. So she gets COVID, she has the respiratory stuff, that goes away, fairly short course, and then just starts deteriorating over the following 6 months. She finally ends up coming to me. Oh, and she's diagnosed by a cardiologist with POTS, lightheaded, racing heart, fatigue, brain fog, chest pain. She comes and sees me in December 2023. Now, we use rifaximin. We're going to balance the gut bacteria. So here's a normal balance. So that here's stomach, small intestine, large intestine. These birds represent the bacteria in the small intestine, the fish down here. What happens is people get something called SIBO, where you have normal bacteria that are normal in the colon. They're just living in the wrong place. And this causes leaky gut and a lot of inflammation. Okay? Remember, I said our protocol is predicated on lowering inflammation to get the nervous system to recover. So we've known about this problem for almost 60 years, and for the last 20, maybe 30 years, they've been using a medicine called rifaximin in advanced liver disease. If you have advanced liver disease and you have this problem, it's pretty serious, and the rifaximin will stabilize the balance. So we put Marta on continuous twice-a-day rifaximin. She gets some fish oil, olive oil, vagus nerve stimulation. Within a few weeks, she's starting to feel better. Okay, and by May, so we're now 5-6 months later from her initial visit, she should already be cured for the most part, and she's not. She's definitely better, but something's holding her back. Now, around this time, the research was coming out showing that COVID can cause a different kind of leaky gut. So when you have overgrowth here, all right, now this little barrier here, okay, is this line here. That's your intestinal barrier. And these are supposed to be bacteria. So here's normal. Nothing gets through. There's no extra inflammation or anything. Here you have excess bacteria and stuff is leaking through here. We use the rifaximin to get rid of this. The leaky gut stops. That inflammation gets better. That's typically what the patent is all about right there. What COVID does is something different, and where you actually have cells die here, you have this big leak still. It's a different kind of leaky gut, and you have to use glutamine to fix this. Okay? So we put Marta on some glutamine, and the dose is 15 grams twice a day. That's equal to a level tablespoon of powdered glutamine. Within just a few months, completely normal. She said it was like a game changer when we added that glutamine. It was really the missing piece. And they've now shown in these post-COVID patients with this leaky gut, you start glutamine, the inflammation starts dropping within 5 days. It's fairly dramatic. And most of the patients are like, wow, in a couple of weeks I felt really good. In her case, she needed both. Okay? And so she felt pretty normal. Now what do? We got her better. Her kind of maintenance regimen, she needs fish oil and olive oil every day. Okay, these are a function of the food supply and protect us, so she needs to do that. She stopped getting her vagus nerve stimulation. She was using the Vitality Smart Cable, and she didn't need that any longer. And she has, of this rifaximin antibiotic, what we do is we get her a supply of rifaximin, And if any of her symptoms start coming back, like a little racing heart, sometimes they have some intestinal symptoms, whatever. If that starts coming back, like over a week or 2 or 3, you take 10 days of rifaximin. And what that means is when we treated her for rifaximin, we went from this to this, she'll start relapsing. Everybody will relapse at some point. It might be every couple months, or it might be every 2 years. It's going to happen, okay? And so we just train people to recognize that. We call it the SIBO fingerprint. I think I've got another video on that if you want to look at that in more detail. Now, the other case. Jenna's 40. She had a rather severe concussion in 2019 and develops headaches, fatigue, dizziness, rapid heart rate, chest pain, anxiety, and severe premenstrual syndrome. Now, premenstrual syndrome, believe it or not, is a low blood pressure problem. And so she's got POTS. She's kicked around, say this and that, and people with herbs or all these drugs with all these doctors with these different drugs just to manage the symptoms. She finally makes her way to me, and we started on the protocol. Now, instead of, at this point, I was not using so much continuous rifaximin like I have more recently with Marta, but we got away. We were using cyclic rifaximin, which is so the 550 milligrams twice a day, just 10 days a month. So like the 1st through the 10th of every month, you take that. And she also got fish oil, olive oil, and the vagus nerve stimulator with the Vitality Smart cable. Okay? Again, within a few weeks, people are like, wow, I'm starting to feel better. And she was on a very steady improvement. Then she gets COVID. So Marta's COVID started it. Here, Jenna's going along improving, gets COVID. Boom. Okay? COVID's bad. Okay? It racks your nervous system. Symptoms immediately worsen. She doesn't really pull out of it. We gave her, a few weeks after that respiratory illness symptoms, and she was just deteriorating. So I, presumed she had this leaky gut, got triggered by COVID. So we put her on glutamine too. And within just a few months, she's like, great, totally normal. Usually within about 6 months, patients are totally normal, okay? And she's doing well. Again, her maintenance regimen, fish oil, olive oil, VNS, and then occasional 10-day courses of rifaximin if her symptoms start recovering. So both of these are very typical of what we see. I know there's tons of you out there where you don't get POTS, nobody can get better, blah, blah, blah. And I tell you, you can recover. Okay, your brain is, you got stem cells fixing your brain, you've got microglia, there's specialized white blood cells trying to repair your brain, you got neurotropins, which are chemicals that try to repair your brain. You replace 90% of your neurons with brand new ones every 3 weeks. Your brain is just thriving to recover, unless you have chronic inflammation. Okay, and here it's coming from the food supply, the fish oil and olive oil. Your vagus nerve may not be working now because the vagus nerve regulates inflammation, and you might have one or both of these kinds of leaky gut. And when you fix that, magic. People recover. All right? So I hope this is helpful. I've got some other videos about this. Don't forget to hit the subscribe button so you can stay in tune with what we're doing. And everybody, good luck in 2025. Take care now. Bye.